Welcome to the Warfarin Sodium Therapy Training webinar. My name is Carolyn Whittemore. I'm one of the Department of Developmental Services MAP coordinators, and I will be your presenter today. I'd like to thank Courtney Dutra and Christine Clifford from the Center for Developmental Disability Evaluation and Research at UMass Medical School for their technical assistance in hosting this webinar. Warfarin sodium therapy training and the required training guidelines are to be completed only for certified staff who will be administering warfarin sodium, including relief staff. Documentation of the training and corresponding training guidelines must be on site and at the main office. This PowerPoint is an optional tool which may be used to meet the training requirements. Handouts may include MAP Policy 08-5, your agency warfarin sodium medication sheets, agency warfarin sodium tracking system, flow sheets or event sheets, your agency warfarin sodium therapy policy, and protocols. Training of certified staff in warfarin sodium must be conducted by an RN, NP, registered pharmacist, or MD, with demonstrated understanding of safe administration of warfarin sodium on a regular basis. If a certified staff has not administered warfarin sodium for 12 months or more, retraining needs to take place. LPNs who have been trained themselves may provide subsequent warfarin sodium retraining. We'll start with a brief overview of the circulatory system. The heart acts as a pump to move blood throughout the body. Arteries carry blood away from the heart and lungs and is full of oxygen. After the arteries deliver the oxygen throughout the body, the veins bring the blood back to the heart where it's sent to the lungs to get more oxygen, and then the heart pumps it out again. The cycle goes round and round. Oxygen is necessary for all parts of the body to function. The healthy body has a process in place so that if we start to bleed, it will automatically respond to stop the bleeding by forming a clot. A blood clot is necessary to prevent blood loss if accidental bleeding occurs. These are called good blood clots. Some blood clots are not so good. For example, if an individual has atrial fibrillation, which is when the heart has a fast, shallow beat, it will not pump the blood the way it should. Some of the blood will get pumped out, but some of it will stay in. If it stays in for too long, a clot may form. If a clot forms, it may eventually get pumped out of the heart and then get stuck somewhere in the body. When a clot gets stuck in the blood system, normal blood flow stops and the surrounding tissue gets damaged because oxygen can no longer be delivered to that area. A clot can also start or form in different areas of the body besides the heart for different reasons. If a piece of the clot breaks off, it too can get stuck somewhere in the body, causing damage. If the clot gets stuck in the lungs, this is called a pulmonary embolism. If it gets stuck in the brain, it's called a stroke. If it gets stuck in the legs, this is called a deep vein thrombosis. If it gets stuck in an arteriole of the heart, it causes a heart attack. These are bad blood clots. A stroke is damage to the brain and can be caused by one of two things. The first is a blood clot in the brain which stops the flow of blood, causing damage to that area of the brain. This can happen if a piece of blood clot from a different area of the body breaks free and then gets stuck in the brain. Or secondly, a vessel in the brain breaks, causing blood flow into the surrounding area, causing damage. This can be made worse if the body cannot form a good blood clot to stop the bleeding. An anticoagulant is a substance or medicine that prevents blood from forming clots, often called a blood thinner. Warfarin sodium is an anticoagulant medication used to prevent harmful blood clots from forming. Often, warfarin sodium is used in the treatment of atrial fibrillation, after a recent heart attack or after certain surgeries, for a deep vein thrombosis or a pulmonary embolism. Each individual who has warfarin sodium ordered must have a specific diagnosis for its use. The key is to keep the blood flowing smoothly so bad blood clots will not form, but the body is still able to form a good blood clot if needed. This is a careful balance which requires constant monitoring by blood tests. When determined that an individual will be started on an anticoagulant medication, the HCP will order a PT-INR lab blood test and an individual-specific target INR range. The prothrombin time, or PT, measures how long it takes blood to clot and is used to monitor the effects of the anticoagulant medication or warfarin sodium. Laboratories use different test methods to measure the prothrombin time. Since the PT test results are not consistent from lab to lab, it may be difficult for the HCP to determine the desired effect of the warfarin sodium just based on the PT test result. For this reason, the PT results are converted by the lab into an INR result. The International Normalized Ratio, or INR, allows the healthcare provider to understand the PT results even when they come from different labs or are done by different testing methods. Because of the different PT testing methods, it is important to realize that some labs will only tell you the individual's INR test result. After the INR is obtained, it is key to caring for the individual to know if the INR test result falls within the individual's established target INR range. If it is not within the target INR range, the HCP may decide to change the warfarin sodium dose. For example, if the individual's established target INR range is 2 to 3, a PT INR level is obtained. If the INR result came back as 1.8, that's too low, it's out of range, and the HCP may order an increase in the warfarin sodium dose. If the INR result came back as 3.6, that's too high, it's out of range, and the HCP may order a decrease in the warfarin sodium dose. The PT INR may be ordered monthly, weekly, or even daily until the therapeutic effect of the medication is reached and the INR falls within the individual's established target range. Remember, the higher the INR, the longer time it takes for the blood to clot and the risk of bleeding increases. The lower the INR, the risk of forming a bad blood clot increases. On the screen is a list where PT-INR blood tests may be obtained. If the PT-INR blood test is obtained in the home setting, the test must be performed by a licensed staff. Certified staff are not allowed to perform the test. Whenever there is a change in warfarin sodium orders, the change must be communicated to all staff. A note must be written in the person's record. On the screen is an optional form which may be used. The HCP must be consulted with whenever there is a change in the individual's medical condition, since the dose of warfarin sodium may need to be adjusted. For example, high blood pressure and a high PT increase the risk of stroke by vessel bursting. Warfarin sodium can also be affected by other meds, foods, and/or herbal preparations. Because many medications interact with warfarin sodium, The HCP must be consulted with anytime a new medication is started or stopped. Vitamin K is necessary for the body to form clots. However, a diet high in vitamin K works against the action of warfarin sodium and can make it hard to stabilize the PT or the time it takes the blood to clot. While it is not necessary to avoid foods high in vitamin K, it is very important that the amount of vitamin K eaten remains consistent, a well-balanced amount each day. This will help the PT-INR to remain stable. Doing any of the following may change the amount of vitamin K levels in the body. Increasing vegetable intake as part of a diet to lose weight. Eating more vegetables in the spring and summer because they're more available. Being sick and not being able to eat well for a few days. Or returning to a normal diet after being sick. Diet and/or changes in diet should always be reviewed with the HCP. Each individual receiving warfarin sodium should follow a specific, well-balanced, consistent diet plan. Because vitamin K decreases the action of warfarin sodium, it's often used as the treatment for a warfarin sodium overdose. Herbal supplements and spices can also interact with warfarin sodium, and there's more than what are listed on the screen. All herbal supplements, botanicals, and spices should be reviewed with the HCP. Alcohol can increase the effects of warfarin sodium, making the blood even thinner. Nicotine increases a person's risk of heart attack or stroke by increasing heart rate, narrowing blood vessels, and it stimulates the body's natural defense to form clots. Therefore, if an individual smokes or gets nicotine by another method and is also receiving warfarin sodium, their risk for injury increases. Alcohol and nicotine use should be reviewed with the HCP. Unlike most medications, warfarin sodium is supplied as a color-coded pill based upon the strength of the tablet. Each warfarin sodium tablet color represents a specific strength. As with any medication, staff are never allowed to split tablets to get the correct dose. This must be done by a pharmacist. Administering warfarin sodium at the same time each day helps to maintain a consistent blood level and with the accuracy of the PT-INR results. A two-person check is required to ensure the correct dose of warfarin sodium is prepared. The second certified or licensed staff should compare the healthcare provider order to the pharmacy label to the med sheet and verify that the correct warfarin dosage was placed in the medication cup. The second person is verifying that the correct dose was prepared, not watching that medication is being administered. Warfarin sodium should be transcribed onto dedicated warfarin sodium med sheets. Notice the spaces for start and stop dates for the second staff check, the next PT-INR date, special precautions. At this time, review samples of the warfarin sodium med sheets your agency will be using. If only one certified or licensed staff is available, the dose may still be administered. To document this, the first staff enters a circled X in the second check medication box. The circled X indicates a second certified staff was not available to verify the dose. A circled X may be utilized and added to the acceptable code list on warfarin sodium med sheets only. An additional progress note would not be required. As with all HCP orders, any orders received from an anticoagulant management service or Coumadin clinic must be signed by the HCP to be valid. Whenever there's a change in HCP warfarin sodium orders, the change must be communicated to all staff, verbally or in writing, a narrative note written, a directions change sticker or brightly colored sticker applied to the medication container to indicate there is a new HCP order that must be checked. The old order is DC'd on the med sheet and the new order is transcribed. The pharmacy must be contacted anytime there is a change in HCP orders. When the dosage of warfarin sodium is not stabilized and there will be frequent dosage changes, it is acceptable for the healthcare provider to provide the pharmacy with a prescription that does not include a specific dosage amount. The label instructions would read as directed by HCP order. Staff must look at the HCP order to determine the number of tablets to give to equal the dose. For example, the prescription for the pharmacy label would include the individual's name, the medication name, the strength of the tablet, the route, the frequency, and then no specific dosage directions. It would be as directed by current healthcare provider order. Each agency must have a tracking method in place for warfarin sodium. Some examples of tracking are listed above. If blister pack monitoring is done, be sure to include the date, time, and initials of the staff administering the medication on the back of the blister pack for each dose administered. If added to the count, each strength of warfarin sodium must be entered on a separate line on the index and have a corresponding count page. Flow records or event sheets may be used to record HCP orders and lab dates as they continue to change. At this point in your training, pass out any copies of tracking forms your agency will be using for staff to review. The agency policy must include administrative procedures to be followed when there's a medical emergency related to the administration of warfarin sodium. Again, at this point in your training, pass out copies of your agency warfarin sodium policy for staff to review. Each individual who has warfarin sodium ordered must have an individualized warfarin sodium protocol. The protocol would be signed by the HCP and kept in the med book with the HCP orders. Pass out and review any individual specific protocols at this time for staff to review. On the screen are a few of the signs and symptoms a person may experience from too much warfarin sodium. Changes observed should be reported to the HCP as soon as they are noticed. They could be life-threatening. On the screen are more signs and symptoms of bleeding. A high INR can be treated by administering vitamin K. This would require an HCP order. Remember, vitamin K plays a major role in blood clotting and when prescribed will help lower the INR, thereby decreasing the risk for bleeding. Know and follow your agency policy for medical emergencies by calling 911 if needed. Prevention is key to safety. Do not miss lab appointments. This is the only way to know if the PT INR is in the target INR range. Certified staff who have not administered warfarin sodium within a 12-month time frame must attend a warfarin sodium retraining. Remember, safety and prevention, keep all HCP and lab appointments, give warfarin sodium at the same time each day, report changes when observed, and monitor diet. You are key to safe anticoagulation therapy. If you have questions on information presented, please contact your MAP coordinator. Thank you.